work for transport and accessibility in low-income communities. And for this seminar series, we're mostly going to focus on the outputs and impacts from our research that has been coming out of this network for the last 6 years. For the first section, we're very lucky to have representatives from the Inter-American Development Bank who are going to present their report on transport for socially inclusive development. We are going to have 6 seminars in this series, and we'll be advertising the next one at the end. So without further ado, I'm going to hand you over to Diana Sandoval, Lynn School, both from the Inter-American Development Bank, and Daniel Oviedo, who's well known to us, who runs the INTALiNC LAC part of INTALiNC and is based at the UCL in London. Thanks, Daniel, over to you.
Great. Thank you, Karen, and thank you everyone that is joining today's session. We're very happy to share some of the findings from this report. And I'm very glad to be joined by my 2 fellow speakers. So we have Diana Sandoval. She's an architect and urban planner with 20 years of experience in urban transport projects. She's a social inclusion consultant at the infrastructure division of the Inter-American Development Bank. She has an MA in design and public space from Pompeu Fabra University and a master's in development planning from UCL. She has long experience on public space, and she was the director of urban studies in the Chamber of Construction of Bogota in Colombia. We also have Lynn School, who is a lead transport specialist at the IADB. She's currently based in the Bahamas, and she was the coordinator for the publication, which throughout the webinar, we're going to share with you some insights and how to access the report, which is completely free. She has led and authored several studies related to the links between transport, social inclusion, and poverty reduction, and she has a PhD and a master's degree from the Goldman School of Public Policy at the University of California in Berkeley. And then it's me, which I hope the majority of you know me. I'm Daniel Oviedo. I'm associate professor at the Development Planning Unit of UCL, and I've been working on issues related with transport and social exclusion across Latin America and more recently in Sub-Saharan Africa for some time. So the reason that we wanted to hold this...
Stop sharing, Daniel, and let you introduce.
No worries. No worries. Thank you, Karen. Well, very quickly, the reason that we wanted to share this publication with you, which I'm going to put in the chat so everyone can have a look at the link. This is a book that took over a year in the making, and which has very strong links with the INTALiNC network. So actually we had Karen and a few other members of the INTALiNC network providing peer review, as well as different members of the network authoring some chapters in the Latin American region. And the book discusses something that is not frequently seen in policy circles, especially from development agencies such as the IADB, the World Bank, and others, where they put inclusion at the very center of trying to plan and develop transport for a region that is perhaps one of the most unequal in the world. So the book brings together not only very topical and recent research, but also it has a flavor of policy engagement and provides recommendations that are not only relevant for the Latin American context, but also for other parts of the Global South. The bank will be holding its own webinar series around the book, which we'll be sharing through the INTALiNC network, and you're of course welcome to listen to and participate that as well. So without further ado, I'm going to leave the floor for Diana Sandoval, who's going to present chapter 2 of the findings from chapter 2 of the report on vulnerable populations with an emphasis on disability. Diana. Diana, we can't hear you if you're speaking.
Yes, sorry. Are you looking at my screen?
Yes, we can see your screen now and we can hear you.
Let's check something because I need to just, let me see if it's better this way. Okay. Are you looking at my screen?
Yes, and we can see your slides moving.
Okay. All right. Thank you. So thank you very much for inviting me to these talks. I'm Diana Sandoval. I work for the Inter-American Development Bank, and I'm here to present you chapter 2 of this publication, which is One Size Doesn't Fit All: Barriers to Mobility and Accessibility for Disadvantaged and Vulnerable Populations in Urban Areas. So this chapter, in this chapter, we talked about the inclusion of women, of children, of elderly, and of people with disabilities. But today I am going to focus on the research we have done on people with disabilities. I just want to check that do you pass to the next screen, okay, thank you, I'm sorry for that. Okay, so just to give a context of persons with disabilities, an estimated of 70 million persons with disabilities live in Latin America and the Caribbean. And this group is overrepresented in the poverty and extreme poverty. There are in 1 of 5 households of a situation of extreme poverty lives a person with disability. And although it's 12.6% of regional population in Latin America, there are very few studies that will get into the transport and mobility of persons with disabilities or reduced mobility. However, we find out in the latest mobility survey of Bogota that they did this research regarding the modes of transport and socioeconomic strata of people with disabilities. And we find out that there is a higher share of persons with disability from the higher socioeconomic strata using private vehicles and taxis compared to persons with disabilities from lower strata who travel mainly by foot and public transport. You can see here in the graph, the green is walking, private transport is in purple, and yellow is taxi, and blue and red are public transport. So this is basically some of the modes they use, and in this going on in this graph. So this is also from Bogota, and you can see how walking, this is compared the modal share disaggregated by people with disabilities and people without disabilities. And so we can see here that people tend to walk more, people with disabilities and people without disabilities. They use more public transport and they use more taxi. And then we have the comparison on a very small city that is also closer to Bogota, Tunja, which is around 200 inhabitants, 200,000, sorry. And then you see walking also, there is more walking. And there is more use of taxi, but then there is less use of public transport, mainly because there is no accessible public transport there, different from Bogota, at least. Transmilenio and some of the BRT are more accessible. And so then we have a lot of accessibility barriers for people with disability and reduced mobility. But then what is accessibility? And accessibility is a precondition for persons with disabilities to live independently and participate fully in and equally in society. Without the access of the physical environment to transportation and other facilities, persons with disabilities would not have equal opportunities to participate in their societies. Without access to transportation, there is no access to education, health, employment, recreation, and different services. And so I'm just going to go very fast. These are some photos that we have taken. We in the Inter-American Development Bank, we do some audits we have done in several cities in Latin America, which are some accessibility audits in transport. And so we're going to see some of the barriers we find. The main barriers we find are, well, of course, inaccessible transport. What happens sometimes is, although the bus might have a ramp and might be accessible, then the ramp might be broken, or sometimes drivers don't know how to operate it. In this case, the person that wanted to get into the bus wasn't able because the ramp was not working. Also, there is the attitude of drivers and staff. It is very common that they do like route driving. And so persons with disabilities or reduced mobility will have to yell at the driver to please stop, and so they can get off the bus. Then, of course, there is uneven sidewalks and broken road surfaces, which is very common. Then you have also the lack of accessible and reliable information, poor signage and wayfinding. In this case, although you have the sign here, the letter is so small that you couldn't see where is it going on. Sometimes there is not enough contrast to understand what is the information the transport system is giving you. Then there is the danger of traffic and lack of road safety. This is very common. This is a photo we took in Curitiba. The sidewalks were they were not accessible, so the person will have to move over the streets. And of course, this is very dangerous because cars are passing very, very fast. And then comes also the overcrowding of vehicles in terminals. It is very difficult for anybody with a disability to access all these lines. And also we find in another survey that was done in 39 countries and where 257 persons with disabilities participated. Additionally to these barriers that I just mentioned, there are also is the cost and affordability of public transport, high curbs and deep storm drains, and lack of accessibility and door-to-door services. And so in the Inter-American Development Bank, we created this methodology that it's called Journey Maps. And what the methodology do is that we basically measure the accessibility of the trips that we do with persons with disabilities or reduced mobility. So there are 7 profiles that are part of the methodology. We do these trips, which is a typical trip with persons with physical disability, with visual or auditive disability, cognitive disability, then people with reduced mobility that can be like women pregnant, or for example, somebody that just have like a recent injury, and also elderly. And so in this methodology, an interviewer accompanies the participant. It takes note and it asks some questions regarding the accessibility of the trip. We evaluate the physical accessibility, but also the communicational accessibility, operational accessibility, and some attitudinal barriers that the trip might present. And so the participant evaluates the trip, grading it from 1 to 5. And so we have done it in several cities. In this graph, I'm presenting Curitiba, Santiago de Chile, Bogotá, and Medellin. And what we found out, there is the lower ratings were done by people with visual disability in Bogotá and Medellin. This is basically because there were no auditory signals in any of the buses that they travel. And also, it was one of the lowest was the person with physical disability in Bogotá. This is due to the broken surfaces and sidewalks, but there was also that there are many cycle paths over sidewalks in Bogotá, and this creates a lot of conflict in the intersections, and it makes the person feel unsafe to be around the cycles that are passing very, very fast. And also in Curitiba, what happened with the caregiver profile was that it had a situation with the operator that didn't understand or didn't knew about autism, and so it's mainly that there is a lack of awareness in stations by operators in order to attend the needs of a person with disability. Overall, the highest qualification of accessibility was from Medellin, which is 4.1. Then Santiago de Chile, 3.8, Curitiba, 3.7, and Bogotá, 3.2. Well, then another situation that happens with accessibility and transport is that there is an absence of adapted bus fleets. The graph you're looking at, it's from Brazil. And in the green is what it's fully adapted, and the rest is partially adapted, which is yellow, and then without adaptation, which is orange. And not only, well, there is a lot to be done in that aspect, but then sometimes when the buses are bought, they are so, the steps are so high that it's difficult for anybody just to get on the bus. And there is no adaptation of the buses that they already have. So what can we do to make transport more accessible? So of course, we have universal design, which is the process of creating products that are accessible to people with a wide range of disabilities, and to everybody. This is not just for people with disabilities. The idea is that, or the principles of universal design are equitable use, flexibility in use, that it is simple and intuitive, and that size and space for approach and use, and also to make it low physical effort. Some examples of universal design in transport might be just the tactile pavement, to have signage with contrast, the smooth and level flooring entrances when transitioning materials, to have wooden doors and hallways beyond wheelchair requirements. And basically is to think about the different types of persons when you're planning and designing any transport project. But also, how can we make it more affordable for people with disabilities? So not in all the cities in the region, but in some, there is free transport for persons with disabilities and for the elderly. Some of the ones that have free transport for people with disabilities are Buenos Aires, Sao Paulo, Curitiba, and some where you have a fair, like a discounting of the fair price, which goes from 50% to 15%, are La Paz, Medellin, and Quito. And then another aspect of subsidies is paratransit. So paratransit is service on demand and is provided by the municipality for people with severe disability that cannot travel in public transport. Of course, these services are more expensive because of the cost of operation and maintenance and the drivers. But the city of Sao Paulo has managed to have a very feasible way to have this service for persons with disability. They have it mainly for persons with autism, deaf blindness, and severe disability that cannot travel alone. And Attende is free transportation service for these persons, and it's managed by the municipality of Sao Paulo and by Sao Paulo Transporte, and it's operated by public transportation companies and accessible taxi cooperatives. So basically, people can call to the service centers and plan their trip. The cost for them is free, and the daily cost of the service is $169 a day, which is very good when you compare it to different other paratransit services in other parts of the world. And so finally, just to sum up, the main idea is that mobility is a human right, and then we promote, it's to promote accessibility in the first and last mile of the trip. Sidewalks are also part of the transport chain. The second is to include universal design and new technologies in public transport to make it more inclusive. And the third is to have awareness and create awareness and consider the needs of different people and different kinds of users. So thank you very much.
Thank you, Diana. This was a great presentation. And for everyone who's joined recently, please just feel free to send your comments and your questions to Diana. The idea is to have the presentations back to back, and then we will have some space for discussion. So hopefully the conversation will keep going, but please feel free to interact with the chat for now. Thank you again, Diana. And then I want to give the space to Lynn, who is going to speak about a different part of the report, which speaks more towards the implications for equity and exclusion of coverage on public transport. So, Lynn.
Thank you, Daniel. Sorry, I just need to share my screen. Second.
Daniel, maybe while Lynn is on sharing her screen, you could just say a little bit about her role on the report, because Lynn was like a key player in this, right?
Okay, do y'all see my screen?
Yeah, we can see you.
But
Just, can you switch your display? While you do that, I just wanted to say that Lynn has played a significant role in the development of this report. She was the coordinator and the lead editor in a team of over 20 authors from all over the Latin American region, and also a mix of academics, consultants, and practitioners from the bank. So not a small feat, and you will see how much care she put into the final report when you have a chance to read it. So Lynn, we hear you now. Thanks.
okay, great. Thank you so much, Daniel. So I'm going to take this off. So hello, everyone. Good morning, good afternoon, depending on where you're at in the world. Thank you so much for joining us. And thank you to Karen for the invitation to present this work. Today, I'm going to talk about chapter 4, which focuses on the transit divide. It's called Mapping Inequalities in the Coverage and Quality of Public Transportation. I added in Latin America and the Caribbean, just since we're not going to present the whole report today, just so that you all know that we're talking about this region. In this chapter of the book, we focused on mapping of the barriers that low-income people face and vulnerable populations face in their daily mobility in public transportation. And just to say that the book looks at all different modes. We look at active modes, we look at different vulnerable populations, as Diana just mentioned. We look at the role of technology. The book is 10 chapters in length, and so this is just one of those 10 chapters. So I hope that you will all read the book, and also we will have an IDB series to go more in depth into all of the chapters throughout the year. So stay tuned for that. So for this chapter, we focused on what have been the experiences and the evidence of the investments in the Latin American and Caribbean region in terms of public transportation. We looked at BRT systems, bus-based reforms, as well as aerial cable cars, which have been an innovation in the last 10 to 15 years in the region to help reach low-income populations. We finally closed the chapter by providing recommendations on how to bridge these gaps in public transportation coverage and quality. In the Latin American and Caribbean region, we have some of the highest rates of poverty and inequality in the world. Both of these have been impacted and exacerbated by COVID-19. For example, in 2020, approximately 1/3 of the region's population was living in poverty, which was a 10% increase from 1 year prior. In the same year, more than 1 in 10 people, or 13% of persons, was living in extreme poverty. This represents a nearly 15% increase compared to 2019. Adequate, reliable, and safe public transportation services are fundamental to enable access to opportunities in cities, particularly for low-income populations. This, as Diana had mentioned, walking, but also public transportation is critical for vulnerable populations to reach opportunities to build social and economic capital, as well as access recreational activities. However, in the region, we see that many times the coverage and quality of public transportation is inadequate in the areas where the poor need it most. As you can see from this graph, we looked at six different cities, modal shares for daily travel. As you can see that on the bottom of these graphs for each of the cities, 1 represents the poorest strata and 6 is the richest. And this is using socioeconomic strata, which in the region, this is an indicator or a proxy for income. And it's shown through other research to closely correlate to income. or poverty. So in stratas 1 and 2, those tend to be the poor, very poor and low income groups. We see across all of the cities that low income populations predominantly rely on public transportation for their daily mobility. For example, in Bogota, we see that 54% of the poorest use public transportation for their trips, and as opposed to only 5% or 8% for private car trips. You can contrast that on the right-hand side of each of the city graphs for each city, where you see that private automobile takes a much more important role, up to 70 to 50% of the trips in most cities. And you also see that walking, which is in red, is a key mode of transportation for low-income groups. So we do have another chapter just on walking and active modes. And this is just another graph to drive this point home. You see that most low-income people in the region do not own any motorized vehicle. So the bottom bar is low, the green is those households without any private auto in the household. So 95% or 96% of the population in Lima, for example, does not own a car, whereas high income groups up to 35% do. And you see this pattern across the board. In Sao Paulo, you have almost 73% of the population owning a car, whereas 78% of the population in the low income group does not own any vehicle. In this, I just want to make a note with climate change, and there's a lot of work going on now in the IADB in terms of reducing emissions, greenhouse gas emissions. And I think it's critical to understand the needs of those people who are now using public transportation because they don't own a vehicle, and make sure that people are able to access key opportunities using sustainable modes, not only for the economic development side of things, but also in terms of environmental sustainability. So as I mentioned, public transportation services in poor neighborhoods in the region are often characterized by limited coverage and quality. Due to this limited coverage of public transportation, low-income groups and vulnerable groups spend a disproportionate amount of time walking. And oftentimes these journeys, walking to reach public transportation or to reach their destinations because there is no public transportation available for where they need to go, they're often walking highly hazardous conditions. If someone has a disability, of course, this is even more difficult. But even for the average family walking with children, as you can see in this photo here from Lima, it's quite an arduous trip, and often filled with many dangers in terms of traffic safety, as well as crime, as you'll see in future graphs here. Walking distance, you can see from this data that we show in the report, on the blue bars represent the low socioeconomic groups, and the green are the non-low income groups or non-low SES groups. So we looked at 3 cities. This is based upon a survey that we did for research in 2020. We gathered more than 2,000 data points in each of the cities. And this is one of the largest surveys in the Latin American region that looks at public transportation patterns. So we see that in Bogota, we have the low-income groups, only 20% of those of that population is within 10 minutes walking distance to a public transportation station. This looks at mass transit, so BRTs and public transportation. As opposed to the higher income groups in the green, you see over 30%. So as you see this inequality here, those people who need public transportation the most, who don't have vehicles, have the least access, and you can see that throughout all the cities if you go down through each graph. In contrast, you see on the far right of the graphs, you see almost 30% of low-income groups have to walk more than a half an hour to reach public transportation. In Bogota and Mexico City, that reaches almost 32%. As a result, oftentimes low-income populations need to travel in informal modes, or they need to travel longer distances. This is also related to graphs that I'll show in the upcoming slides, but they're often exposed to higher levels of air pollutants and safety risks. Women often face high levels of sexual harassment and violence in public transportation. And the conditions in which they travel are often very crowded and uncomfortable for people with disabilities, but also for anyone. And this also, this overcrowding lends itself to enable and make it more difficult, and also make sexual harassment and violence more prevalent in public transportation. So this is a huge barrier for women. This is touched upon more in chapter 2, but this creates barriers in terms of women's accessibility to opportunities, because they often limit the times of day that they will travel or the modes that they use. And this can create inequalities in terms of expenditures on public transportation, which Daniel will touch on in a few minutes. We also see that commutes are very long for low-income populations, and this has to do with low-income populations having to live further out from the city core, from the city center, due to inaffordable housing in closer to opportunities. As you see, strata 1 is the poorest and strata 6 is the richest again. You see the lowest SES groups on average for these 6 cities have an average commute time of 77 minutes on average, and the highest in contrast is around 53 minutes. So that's a 50% longer commute on average. One of the highest, the most marked differences is the city of Montevideo, where you see that the travel time differences between the lowest and the highest income groups is 2.5 times. There are also barriers in terms of not only inadequate walking infrastructure, which Diana clearly showed, but also crime. Crime is a huge problem throughout the region, but particularly in lower income groups. Low income groups tend to be more exposed to crime. And in the survey, we clearly saw a pattern that while everybody is concerned about crime and public transportation or walking to public transport, low income groups are disproportionately concerned or perceive that their environments have higher increases of the probability of being robbed or experiencing crime. So this also creates barriers. Particularly, again, this impacts women or vulnerable groups, people with disabilities, people who are older, are more vulnerable to crime, and so they're less likely to take trips at certain times of day. And this circumvents the number of opportunities, the times of day that people can access their opportunities in the city. Comfort is a key indicator or a proxy for comfort in public transportation. You see that by and large, although throughout these 3 cities that we looked at, most public transportation users perceive public transportation to be pretty uncomfortable, but you see that low-income groups are more likely to say that their public transportation services that they have access to in their neighborhoods are not comfortable. They have very bad quality or bad. So you see on the far left-hand side of the graphs, they're very bad and bad. The blue is, again, low SAS, and the green is high, or not high, but non-low. So you see, for example, in Bogota, 44% of low SES, or if you add the 2 groups together, you see that a large proportion of the low SES rate public transport services as highly uncomfortable. A lot of these tendencies or these trends that I'm showing here have to do with rapid urbanization and sprawl that has exacerbated the cost of transport for all groups, but particularly for those living in poverty, those with disabilities, those with transport disadvantage. This has led to a growing sprawl in the suburban areas. You see not only urban sprawl, but you see a proliferation of informal settlements of people that have gone to the suburbs looking for affordable housing. However, the public sector has not kept pace with this urban sprawl. Land use and transportation is often not well coordinated. That goes for many cities in the world, including the US. I would say in most cities it's not well coordinated. And then Latin America, land use changes are outpacing governments or cities' investments in infrastructure for transport. And so this impacts, of course, low-income groups the most. So they often only have access to informal modes of transportation. As you see here in Bogota and Buenos Aires, as you see the urban footprint in 2022 has expanded way out into the peripheries. You see the density of the public transportation network overlaid on the urban footprint. And you often see that in those far-flung areas where low-income populations tend to live, you have far less options in terms of public transportation infrastructure. In addition, suburban developments such as car-oriented gated communities can further exacerbate transport-related exclusion. These communities often are large, and they create these sort of islands of privilege where other people cannot access, cannot enter. They're very car-oriented, so public transportation services, whether they be formal or informal, are very unlikely to go to these areas, but yet oftentimes there's a juxtaposition of very poor neighborhoods that live around these areas, so they have to walk very long distances to access activities because they can't walk through those neighborhoods, and there's often no public transportation going directly to their destination, and that again contributes to those long travel times that you saw in the graphs earlier. As I mentioned before, informal transportation is prevalent in the region. More than half of public transportation trips are made by informal public transportation modes. While they often serve an important role for low-income groups in terms of providing affordable transportation, the vehicles tend to be older, under-maintained, and highly polluting, and characterized by overcrowding as well, high levels of insecurity, and high levels of traffic safety risks. The COVID pandemic obviously exacerbated all of these issues. We saw public transportation operators saw precipitous declines in demand for public transportation. At the same time, they had increased costs in terms of maintaining protocols for social distancing, sanitary protocols, and this resulted in lower revenues. Nevertheless, I see I have a few minutes left. Nevertheless, those who are the most vulnerable continue to use public transportation. They weren't able to comply with lockdown orders, and so they had to continue traveling under worsened service quality conditions. So to what extent have public transport investments benefited the poor and vulnerable groups? In the late 1990s, Latin America and the Caribbean has witnessed major transit reforms aiming at transitioning the public transportation system from informal, low quality services to large, robust, and integrated transport systems. There have been over $124 billion invested between 2016 and 2022. Many lines of BRT systems have been installed, aerial cable cars, as well as new metro systems or extensions. We looked at 5 different cities. I'm not going to go into depth. Most of these were BRTs, and some of them were bus reforms. We also looked at 3 cable car systems. Just to summarize some of the benefits, BRT systems by and large in the region have improved the quality of service where they have operated. They've reduced travel time savings enormously. They've created increased connectivity and accessibility for many in the area of influence of the systems. They use clean, modern vehicles, lower emissions. They improve accessibility by providing universal accessibility standards, improve safety in terms of having lighting, security personnel, and cameras at stations. And they've improved road safety because they have driver training and traffic safety standards. In Lima, for example, we saw reductions in travel time of up to 35%. Large reductions in emissions from the vehicles themselves. And in addition, in an impact evaluation that the IADB implemented, we found that employment rates for those living near the area of influence of the systems increased by an average of 5 to 6%. Women particularly benefited from these services, increasing their rates of labor market participation enormously, and their employment rates by up to 16 percentage points. This is theorized to be associated with the fact that these systems are safer, but they also reduce the amount of time needed to travel from the periphery to downtown enormously. Some of the challenges in this BRT system, but across the board in the region, is that these systems oftentimes don't reach into peripheral areas where the extreme poor live. They also are prone to overcrowding because in the initial years where BRT systems were implemented, they were required to be self-sustaining based upon tariff revenues. And this led to using primarily very large articulated bus vehicles and having lower frequencies or longer walk times to reach systems and requiring people to make more transfers. So the systems, although they did save people enormous amounts of time in transit, they also added time in terms of walk time, access time, and transfers. Oftentimes they were not affordable to the very poor because in the case of Lima, for example, the tariffs were set to be to have cost recovery. So that meant the tariffs were quite high compared to the informal system. And so most of the low income people that we interviewed, because we also did a study in 2017, I believe it was, where we closely studied, we interviewed and surveyed people living near the system who were low income, and most of the people that we interviewed kept using the informal system for most of their trips, particularly the local ones, because it was much more affordable for them. So looking at the cable cars now, we looked at 3 different systems, Trans-Mi Cable, Mi Teleférico in La Paz, and Metro Cable in Medellín. So most of these systems were implemented to reach very difficult areas that are difficult to reach with with conventional public transportation systems. And the goal in all 3 of these cities was to reach very impoverished areas that at the time did not have access to any formal modes of or means of transportation. They also were accompanied by many social programs, and also particularly in the case of Medellín and Trans-Mi Cable, as well as all 3, actually, they included land use changes where they invested in parks and in urban reforms around the stations, which added a lot of value in terms of social benefits. So some of the benefits for cable cars that we saw in these 3 cases were improved quality of service, improved accessibility, both in terms of reaching destinations that were previously would have required very long trips and informal buses or informal transportation, increasing the accessibility to downtown areas that were previously involved very long trips, but also they employed universal accessibility standards at stations and in vehicles. Safety was improved, as well as these cable cars are low emission, they're quiet, so they reduced noise and air pollution. As I mentioned before, there were also several social and land use benefits associated with them. They transformed the areas around the stations, they added healthcare centers, educational and recreational opportunities around the cable stations. And impact evaluations, many academics have found that users, after the systems were implemented, were able to devote more time to activities that contributed to their well-being, such as exercise, recreation, and leisure. For example, in Mi Teleférico La Paz, this system connects from El Alto, which is a very low-income area in the metropolitan region of La Paz. This system connected this area of El Alto to La Paz, which they climbed over, I think it was almost 900 meters. So El Alto is a city that's more than 4,000 meters high. And previously people had to take informal buses or taxis that would wind along very steep roads. It would take an hour or more to get downtown to La Paz, and now with this system they can get there in 10 minutes. There are now over 6 lines in the city, and there have been significant benefits in terms of reduction of travel time, as well as an impact evaluation that the IADB has conducted. Have found that there was an increase of 50% of self-employment and income for people who lived in the area of influence of these systems. Some challenges, though, across the board in all 3 cases, we saw that there are still affordability barriers for the extreme poor. Very poor people in surveys have been found not to be using the system because the informal system is still much cheaper for them. And so even though they would save enormous amounts of time, their ability to earn wages does not compensate them for the cost of paying for the cable car. So they continue to use informal modes. The systems also have low passenger flow rates. So that results in longer waits to board the system during peak hours. The time to access stations has also been an issue because they need to cross a difficult terrain in many cases, and informal transit plays a key role here in helping people access these systems, but oftentimes informal transport can be villainized. And so it's important to remember that access modes are needed in terms of accessing these cable car systems. And just to finish,
we're sort of well over your allotted 20 minutes.
Okay.
I wonder
Okay,
if you could maybe, I mean, the slides will be available. I wonder if you could maybe sort of just bring us to a couple of wrapping up comments.
Okay, just to wrap up,
Thank you.
we have a series of, thank you, Karen, I have a series of recommendations that are in the report. You can read them here, and I won't go through them all since I know I'm way over time. So thank you very much for your time and attention. I will leave you here with the QR code. So if you'd like to download the report and read it, you can do that here. And again, please stay tuned for future webinars regarding this book. Thank you.
Thank you. Thank you, Lynn. So maybe after during the conversation, we can put on the screen that last slide, which will allow people to scan the codes in their screens. Just to close, and I'll try to be quick, so we have some time for discussion. I wanted to speak to you about this chapter 8, which speaks about once we have seen this landscape, what's happening with vulnerable populations, so what's happening with public transport. I want to take our attention to another big challenge, especially for rapidly growing economies such as those in Latin America and Sub-Saharan Africa and many other parts of the global south, where we have seen a boom of shared mobility. And shared mobility has substantial potential for promoting social inclusion, but it carries risks of exclusion. And that's a bit of what I'm going to share to you with you today. So very quickly, I'm going to set the context, frame the discussions, talk about who uses app-based transport, and you will see a few of these annoying acronyms throughout my presentation, so apologies in advance. And then a quick reflection about shared mobility and social inclusion. So in terms of the context, this is a map from 2020 where we mapped out the number of ride-hailing companies that you could find across Latin America. And you just need to look at the map. A quick glance at the map tells you that is essentially everywhere, and it's probably here to stay. The region has the highest number of simultaneous trips in Uber, for example, with more than 25 million around 2018. Is something that with the pandemic has experienced some changes, but in general, it still plays a role in the mobility landscape of our cities. In Mexico, for example, microtransit, which we can see it here, you see here, these are the types of app-based transport that we find. In Latin America, in some cases, ride-hailing is also provided through motorcycle taxis, but those have been a bit more contested in different countries. But thinking about microtransit, which is app-based collective transport, we have seen an emergence, particularly in countries like Brazil, in Mexico, where some of the initial players in this business actually have raised significant funding. In some cases, even bringing big companies from elsewhere, such as the case of Urban, that was later acquired by a Middle Eastern company that was also working in this space. And we also have dockless bike sharing systems and e-scooters and shared e-scooters, which we have seen in different parts of the region. But again, with the pandemic, oh, sorry, I'm listening to someone else's microphone. If you can keep yourselves muted, we'd appreciate it. Right, so in the e-scooter, in the scooter space, by April 2019, the region had 73 systems in 31 different cities, the majority of them in Brazil. But because of the pandemic, by June 2020, there was only 14 systems remaining in operation in 12 cities. So it's something that sort of has come up and down, but it might make a re-emergence as it has in some European cities in recent years. Now, in terms of framing the discussion, and this is a nod to Karen's work, and this is building on one of her papers from 2012 about social exclusion. What we try to do here is to bring together different factors of what we're calling not just disadvantage, but also as a continuum advantage. right? And that has a lot to do with intersecting social identities or gender, class, etc. Disposable income. In the case of app-based transport, digital skills and affinity with technology become very important. And we are now more conscious about the role of care responsibilities, fear of crime, family dynamics, and social capital in the use of different forms of transport. And same from the transport side, there are disadvantages. So it can be an advantage if you have access to a car or motorcycle or access to public transport. And there is also issues of vulnerability to crime in public transport and in public space, which I'm going to speak about later. Then these disadvantages are mediated by the services and features of app-based transport. And some people might actually suffer from transport poverty from this on demand, which if it's your only choice and you cannot afford or you cannot access it, then you are probably going to be suffering inaccessibility and therefore transport related social exclusion. Now, on that last one box, and this is another note to previous work that we have done. I've worked for some time with the concept of transport-related social exclusion in these different dimensions. And this is sort of a reworking of those 7 dimensions that were proposed initially by Church, Frost, and Sullivan, where we think about economic from features of app-based transport, so affordability, coverage, crime prevention and response, and also what are they doing around sexual violence and abuse, how the facilities are geared towards users with disabilities, which is a big challenge, as Diana was mentioning earlier, and also what's happening with issues of discrimination, which you will understand why we added this here in the framework, and also the app-based transport as a facility in itself, how can it impose some restrictions on its users. So the first thing, and here I'm trying to remain consistent with the framework, when we think about who is using app-based transport in Latin America and the Caribbean, this is an example from some surveys that we collected with support of the bank in Bogota a few years ago. And what we're finding here is that if you have a quadrant with advantages and disadvantages, social and types of users, so you have different types of advantages, different types of disadvantages. What we find is that those who are using it, you have the advantage user, which is who you would expect. Is wealthier people, is people with more with a higher level of education, who has a similar or pays a similar fare to that of the taxi, that is very much in favor of it. And that's important because in some cases we have also advantaged non-users who don't like the ride hailing and prefer the taxi just because in a context like Colombia, it was illegal. Then if we see those who are disadvantaged, we get that there is a young middle class non-users who are young, who have a median income, and that are more of a productive age, but they don't have access to a car. Then you have the carless middle income users who are young, educated at the undergraduate level usually. More people that are studying, so the non-users that are in the middle class are people that are more working. They make longer trips and they find ride hailing cheaper than the taxi, and they're very much in favor. So a lot of it has to do with the attitudes of people towards ride hailing. And then you have the disadvantaged non-users who are usually the poor, people with lower levels of education and lowest economic status, fewer people with driving licenses, no car owners, and high reliance on public transport. So you start seeing how between those users and non-users of this on-demand transport, in this case ride hailing, you get that high level of diversity and potential drivers of inequalities. And here we have examples from other studies that we have conducted. In the case of Mexico City, you see here that TNC stands for Transportation Network Companies, which are essentially the providers for app-based transport. You see that people with higher level of education are nearly the 60% of the users of this type of transport, which is much higher if you compare perhaps except for the car, and even in the case of the car, the percentage is lower. So you get a higher number of highly educated people that are making the transition towards this type of modes. And here we have the same. So by socioeconomic status, what we have here is the frequency of use of ride-hailing services, and we see that higher income people tend to use it more frequently, which is here at these darker parts of the bar. Same with the higher level of education, and then the opposite is true for people with lower income and lower levels of education. So who uses really this type of transport? In many cases, we find that private car users have started to find not only ride-hailing, but also app-based collective transport, such as microtransit. So we have here an example from Brasilia. So 80% of riders of the City Bus 2.0 bus service, which was using an app for coordinating its operations, had used private single occupancy vehicles before. And that includes, of course, ride-hailing and taxis. Also the digitally connected, and it's important to consider the huge digital divide that we have in countries in the region and countries in the global south in general. So less than 70% of homes in Latin America have access to an internet connection. Only about 50% of the population in large cities in the region has a formal account with a financial institution. So there's the divide for digital connectivity, but also the divide for digital banking. And very important is because this is demand responsive, it tends to always look for the more profitable areas, the wealthier parts of the city, or the areas that have more attractiveness. So the wealthier that lives in more advantaged neighborhoods. And there is the other side of the story, and it's who drives this type of services. And this is an example from data of Uber drivers across the region. And some things that jump to the eye is precisely that this is a very male occupation, right? And as people relatively old, I mean, older adults, and in many cases they have a good degree of education. And in the case of Colombia, for example, for a majority of them, this was sort of the alternative source of income. So some of them have other primary source of employment and then complement their income with driving for ride-hailing, or it becomes an alternative for people that is currently unemployed or looking for a job. So you see here that distribution, and in an hourly income of around $11 in average for Uber drivers. We're going to share this, so I'm going to move quickly through the other slides so we have at least 25 minutes for discussion. Right, so having set up that landscape and having seen and discussed a little bit about who uses and who operates this type of services, I want to go through the framework of social exclusion, and I have grouped this here in 6 slides. So Karen, I have 7 slides to go. The first part that I wanted to show you is a reflection about the spatial and temporal coverage, which actually I think complements very well what Lynn was explaining to us earlier. So if you see here from a time perspective, when this is data from Mexico, from Mexico, where it shows the average times at which people from different genders travel. You see a higher number of women tend to travel in hours considered non-peak. So having demand responsive alternatives is something that can resonate with and improve their ability to access different opportunities. And then there is something else that is interesting, and is that people that are at different distances from a public transport station is probably more likely to use ride-hailing frequently. So we have here people that is more than 30 minutes from a public transport station, has a relatively high percentage of frequent use, and the same for others. Essentially, if you are further away than 10 minutes, you're going to be using ride-hailing a bit more. And what we have here is some insights from interviews that we collected in Bogota. And if you ask the companies, actually what they think is that the technology will sort out everything. And that, of course, is related with the pricing mechanisms that they have for the distribution of the supply. So when you have higher price, it makes some areas more attractive than others, and therefore there is an imbalance in supply. And they try to design more affordable to fill the gaps in coverage, but it's not always easy. If you ask a driver, what they will tell you is that the coverage depends on the payment methods, on security, and on traffic. So just to give you an example, the drivers prefer to drive at daylight because of security, in the night because of speed and efficiency, and during the weekends because they get better pricing. So it really depends on what the attitude of the different drivers are. And the local government, of course, as Lynn was explaining, recognizes that there are some gaps. And in some cases, it is the on-demand transport, the ones who are filling those gaps. Now, complementing this, we have an analysis of the economic dimensions, so affordability barriers and enablers. So this started as a sort of middle range service aimed at wealthier population groups. However, over time, companies have started to develop different mechanisms of pricing, differentiated pricing for making the service more affordable, which trade off some features. So they might enable some drivers to use older vehicles to be able to charge a lower fare, and then the user is trading off that added level of comfort or discomfort for a cheaper or more expensive fare. We found a very interesting case, which was pickup. This was in Bogota, and the trade-off was then using motorcycles, and they were very much concentrated in servicing users from the lower income neighborhoods in the periphery. And their selling point, the unique selling point, was that they didn't have surge pricing. They had a flat fare, so it was actually competing very directly with public transport. For the operators, the drivers, the higher the fare, the more attractive the service is. So there is a practice in which drivers are switching between apps precisely to avoid the discounts to the user. So although for users it's good that there are differentiated mechanisms, the driver tends to avoid them because they prefer the higher revenue. And they interpret that the applications do not incorporate their time into the calculations for the fare. So there are also examples from other types of app-based transport, and what we tend to find is that e-scooters, for example, are not very affordable for disadvantaged groups, and there is the example of Montevideo, which you can look at the reference there to find out more. Now, in terms of one of the more important, perhaps, dimensions for this from a social perspective is fear, and fear is related with crime, gender, safety, and security. We have here a clear example, right, from Lima, where the 74% of the surveyed people said that they're using on-demand transport because it is safer. And here you have the distribution of a latent variable for another study that we conducted with the bank about how people of different gender, men and women, perceived the vulnerability to crime in public transport. And you see that the women curve is much more inclined towards a more positive value, which suggests that women tend to feel more vulnerable to crime in public transport. If we look now back at some of the qualitative evidence that we have collected, the truth is that for the companies, the most vulnerable actor is actually the driver. And that's because there is an imbalance in the requirements of information that you have for users and for drivers. So the drivers have to pass many background checks, etc. And the way that they have reacted to this is creating support groups through WhatsApp and through other mechanisms, including some walkie-talkie apps that they use. Essentially, the interesting bit about this is that we find that because security, the Ubers are taxifying themselves, whilst the taxis are starting to find ways of incorporating the technology. Here we have a mapping of the different facilities that the technology enables drivers and users. And finally, this is what we had, what I was just telling you. The drivers use these groups to send alerts and to ask for support, especially when they feel in danger. Now, I'm just 2 slides from finishing this part of the presentation. There is an issue of discrimination, and that's important. In the context of Colombia, for example, because of the heavy immigration from Venezuela, the right-hand drivers tend to avoid users that have a Venezuelan accent or any other indication they might be Venezuelan, because there is a high association with Venezuelans and crime, which of course leads to discrimination. And right-hand drivers themselves feel that they are discriminated and persecuted by the taxi drivers and the traffic police because their service is illegal. On the other hand, if you ask a taxi driver, they will tell you that they feel discriminated by transport network companies because they use the downsides of their service to promote themselves. But this is, of course, a very contested space with very different opinions. Then when we look at the physical dimension, which is related with what Diana was showing us at the beginning, the truth is that there is no mechanisms or policies within the companies to target or to support populations with disabilities. And actually it's interesting because they are very comfortable with it being in the gray area of the regulation. But if you ask them, okay, what do you need for people with disabilities or the elderly to have a better service? Oh, that's the remit of the regulator. So there is a dialogue there to have in order to improve inclusivity in this type of services. And that's supported by the drivers who says, well, it goes in your conscience whether you want to go that extra mile with this type of users. What we have found from the literature as well is that microtransit can provide this type of services. I think Karen was mentioned that in the comments, so maybe I will leave it for the discussion. And then finally, when we think about micromobility, one of the biggest discussions is precisely on the higher level of vulnerability that people with disabilities and the elderly have, especially in the context of an accident. And then finally, in terms of gender and care relations, what is interesting is that the ride-hailing companies have really tried to reach this market group, but catering for these needs, again, is not included in the regulations, so many of the practices are very organic. There are some examples which we found, two of them, Sarah LT and Purple Drive, which were actually providing services by women for women. So it's a kind of a twist, sort of the pink buses in Mexico City, but for ride hailing. And that seems to start having some initial very positive results. And actually what we found from the drivers was that women tend to request more services for others, such as children, partners, and the elderly. So there is another space there that can be improved from a policy perspective. Now, just to close and conclusions and ways forward. The first thing is that looking at things from a social exclusion perspective is really useful. And it really helps us understanding different mechanisms and drivers of exclusion beyond sort of coverage, affordability. So we can think about safety, we can think about discrimination, and many other relevant concerns. The other thing is that it's important to look at this in a continuum of advantage and disadvantage, because especially in these more premium services, you start working more with the middle class and the different inequalities that you have within households. And that, of course, is very important, same as thinking about fear of crime in public space and in public transport. There are two big policy challenges. On the one hand, it's necessary to reduce crime in public transport and make women feel safer, and sort of try to find a way of integrating this on-demand transport with issues of coverage that Lynn was highlighting earlier. Of course, that is overlapping with the problems of sexual harassment and gender violence in public transport. But we could also learn from these private sector initiatives to think about how to technify and improve the public transport quality. And then it's important also to map out these ad hoc approaches and practices, because banning has not worked. I mean, they have continued finding ways of operating, and we need to open a more structured conversation around these issues. And finally, I think what is very important is that we need to find ways of linking transport within each other, and of course, making the pedestrian the priority, but also trying to think about other ways of having flexible transport that can improve or reduce those gaps in exclusion. Thank you, everyone. And here you can see the authors of the chapter of the report. Karen, you're mute.
Thank you to all three presenters. It's an absolute wealth of material there. It's overwhelming, and I do encourage people to go and have a look at that report. And Daniel, if you could just put that link up again, or maybe at the end, it would be great. We'll put the QR code up. So this is the section where we encourage people to ask questions. There's quite a lot of questions in the chat. I'm going to leave it to you, Daniel, to host the questions, because I think you've got more of an oversight of the whole report than I have. But I did want to sort of just start off with one, which is to Lynn, really, is that you managed to do all of this fantastic data collection. And I wondered, it looks like it must be hugely expensive to collect all of that data and very time consuming. And I wondered, how much did the bank invest in all of these studies, and how long did they take to support the report?
That's a great question. I don't have the answer to that because we worked on the report for more than 2 years, and a lot of the data was secondary data that was already collected. So we took advantage of existing databases, but we had also, we were working in parallel on the study that Daniel just showed, and many other papers as well, focusing on TNCs and looking at several questions around transport network companies. And so with that data that we had collected, because within the research, we were focusing on not only the impacts of TNCs on public transport, but also on vulnerable populations. So that database was also very useful for the public transport chapter that we just presented and some other chapters as well. Also, since I arrived at the IADB 10 years ago, I have been focused very passionately on this topic. So I started out in evaluation. So I evaluated the bus rapid transit systems and several other evaluations focusing on poverty and inequality and transport. And Daniel and I have collaborated on several of those, worked in Argentina on that topic. And so really all of the accumulation of work that I've been engaged in with the IADB over the past 10 years informed this flagship, but there was also a lot of new data collection for many of the chapters. For example, the chapter that Diana presented, that's new work that Diana and the team on people with disabilities in transport has done a lot of great work that she showed in terms of really documenting the barriers to accessibility for those groups. And so that also nurtured the report quite a bit. I couldn't go into all of it because it's a long report. It's over 700 pages in Spanish. So, ranging from rural to urban transport technology, et cetera. So the cost, it was funded by a technical cooperation that focused on poverty and inequality. And to your question in the chat, what is the bank going to do? We are doing tons. We have over $10 billion in finance in transport in the bank. The IADB is committed on 3 priorities, which is our social issues. So that's reducing poverty and inequality, addressing climate change, mitigating climate change impacts as well in terms of resilience. And that all of that, of course, focuses on vulnerable groups, because vulnerable groups, particularly in the Caribbean region, are the most impacted. They contribute the less, but they're the most impacted by climate change. So that's the second priority. And third is infrastructure. So infrastructure is key. At the IADB, the transport division, the infrastructure division in particular, has the largest amount of lending for both infrastructure and for technical cooperations, which fund these important studies that we did here, but many others. I'm one of over 2,000 people in the bank, so it's not just the study, but so we are working tirelessly on understanding the barriers for access for low-income groups, but also doing something about it in terms of our investments.
Perhaps if I can just add something quickly there, like sort of the external view, because although the bank is supporting many of the studies, they don't pay me as stuff, so I can't say many things. One of the things that is important, I think, is to sort of break down those black boxing, and sometimes those black boxes that not only come from those large organizations, but also it's very difficult with some governments for them to share data. And I think that perhaps one of the main impactful effects of this type of publications could be precisely to enable a conversation where someone in other part, let's say in the Caribbean, which is, we need to recognize that is relatively underrepresented compared to the sort of continental Latin America. They can say, wait, why are we not doing this as well? If we have the data, or at least we have the capacity to collect it. So I think it could also be a push for engaging in a more active dialogue. And in these partnerships, such as with INTALiNC, it's something that can actually get us further in bringing practitioners and bringing academics into this conversation. Right, there was a specific question for Diana. So Stanley asked, what role did transport policies and legislation played in the cities to enable the mobility of persons with disabilities? So maybe you can give us a couple of examples of policies or regulations that could help in that end.
Thank you. Yes, thank you, Sandy and Daniel. There is the Convention of Rights of Persons with Disabilities, which all the countries in Latin America and the Caribbean have signed. This is like a commitment to make transport accessible and also to promote labor and inclusion in employment and some other aspects. So once the countries sign this convention, they are supposed to implement different laws within the country. Some have implemented it more. For example, I can talk about Bogota in terms of public space. There are some standards of accessibility that should be used when you're constructing public space and works. But then there are other cities, like for example, Curitiba, that doesn't have any kind of standards while you're constructing public space. And then there is also the adaptation of the bus fleet that some cities, they say, okay, so by 2025, you have to have the whole fleet accessible, but this costs a lot of money. So they, like governments don't want to compromise the operators to say, okay, you have to, change all your buses and make them accessible. And then the operators always say, oh, but it's just for 10% of the population. But this is like what we're talking about, universal design and inclusion. It's not only for persons with disabilities, but the accessibility of the buses is for everybody. It's for women that have children, when you carry, your grocery shopping, or when you're having a bag. So there are a lot of aspects that government in some cities don't want to, comply to this. And so they extend these dates. And for example, in Brazil, they have extended the date until I think 2030. And this is why I showed the graph where there was like a very little of adaptation of buses. And then it's also the maintenance. And okay, so, but in the end, like as Lynn was saying, the Inter-American Development Bank is just promoting this. When they are going to buy buses, then we have to make them electric buses, and we have to make them accessible. Of course, always an accessible bus is going to be more expensive than a bus that is not accessible, like the ones that I show in other pictures from Argentina, where they just bought buses, but they are not accessible. So this is a whole, let's say, conversation that has to be drawn to the governments, and we are just promoting this accessibility inclusion. Yes, basically for the new fleet that is going to be bought. And so in the end, the question is like, there are some governments that are implementing some aspects of the policy. And although it is supposed to be like, they have to comply, not everybody does it, because in the end, they still see it as is the problem of just 10% of the population. And sometimes these groups, because they think they are just smaller, they don't think it's like a priority.
Thank you, Diana. There is a couple of extra questions, which are more sort of broad questions. One which I really liked. Let me just finding here. From Priscilla was that, would you say that the actual transport planning logics based on supply demand estimation that guides the way that we practice transport planning is no longer good enough to address the challenges in large, but probably also smaller Latin American cities? And if I can just start, because I have the microphone open already, I would say definitely. I think we need to start thinking about targeted interventions, about forgetting a bit about this very perverse idea of the economic self-sustainability of operation, for example, which started driving up the fares for many years in many public transport systems in Latin America. I think the work that many in this webinar, I see Eda, I see Karen, Jeron, many people that have worked on issues of accessibility would probably agree with me in that once we have identified those gaps, the only way to really address them is through targeted interventions. But I would like to hear from Lynn and Diana, what do you think about that, about challenging the traditional tenets of transport planning, if you want, and Karen as well, why not? Diana, do you want to start?
Lynn, I think it's better you. I please start you, and I'll just respond later. Or you want me to start? Okay.
Yeah, I'm not. Can you repeat the question, because I'm a little. I got.
It's about challenging the sort of traditional ways of planning transport to address the needs of low-income and disadvantaged populations.
Well, I think that, I mean, that goes to I guess my last two slides that I ran out of time to speak to, but I think that in terms of public transport and other transport infrastructure planning, there are several shortcomings when it comes to not just vulnerable groups, but I think in general. One is that we often plan public transportation around peak hour work commutes, which tend to exclude women who tend to take on more of the care-related activities in the household, and that requires a different type of trip pattern. And so if you plan a public transportation system around kind of periphery to center, you leave out all of those people that are caring for others in their trips, making shopping trips or trip chaining. I think we also focus a lot in investments on, and I'm not talking about the IDB, I'm talking more about generally in society. I think that there is kind of this idea that if you need to just invest in large mass transit like metros and BRTs in order to have an impact, but metros oftentimes can be very expensive and they only really are cost effective where you have a high density of populations. More than 50% of the trips in the region, I think I might have that number wrong, it's even more than 50% are on public transportation, are on buses. Most of the transport takes place on buses, and you really need to look at those, and it's not as sexy, or you don't have the big ribbon cutting associated with that, but you can do a lot with very little money to improve bus transport in the region. So I think that mindset that bigger is better is not true. You need to look at those smaller systems. Oftentimes the informal sector is villainized, as I said earlier, and yet they are filling in the gaps where these large expensive systems don't reach. And so that begs the question of how can we really effectively improve those systems. I think app-based technology is a really an opportunity that is just now starting to be tapped into, as you see, and like these small van operations like in the region that serve as commuter vans. They have very little financial support though, so they're struggling, particularly after the pandemic. And so I think we need to look at those and the possibility of providing public finance for that. I think also we need a more disaggregated approach in terms of understanding the unique needs of different population groups, because oftentimes planning is done in a very aggregate way. And I think that lastly, increase the planning side of it in terms of land use. So look at land use and transportation together, but also have institutional structures that are at the metropolitan level or at the commuting zone level instead of at the city level, because those cities oftentimes were established when those cities were quite small and the commutes were within those boundaries. But now much of the commutes are across the city within commuting zones or metropolitan areas, but the planning is taking place in a very fragmented way. So I think there's a lot to be done in terms of supporting institutional structures that can effectively provide metropolitan level transport that is integrated across modes. It's integrated in terms of fares. It's integrated in terms of non-motorized modes as well, including walking access. So in other words, tons of things.
To give Diana 1 minute to answer the question, and then I'll address the last question before passing on to Karen for the closure.
Okay.
Thank you, Daniel. Okay, so I think something very interesting that we've seen working in the Inter-American Development Bank is that we participate in the group of inclusion. We participate in all the transport projects, and then when you are talking with authorities about transport, sometimes they don't even had in mind vulnerable groups. So once once you put this thing over the table, they are, but they just don't even think that they were there. So just putting them there and having these studies and having some statistics and knowing that there are also, as I said, it's not only persons with disabilities, it's also the elderly, which, as you know, more and more, our population is coming older more and more. And then also there are children, and there are also women. And so when you bring the whole, the whole group together, then they will start thinking, okay, so because in the end, as Lynn was saying, many politics just want, the ribbon. That is something that is happening. I'm sorry to bring it, but that is something that is happening. in Bogota's metro, like this is just the thing about the fight of politics. And so then once the politics like come to, like, let's say they own the transport and they just want to, have more votes and things, then you just have to bring those statistics. And then it's just to bring these things to the table and just to make people just, okay, it's not just, it's not just counting cars. It's not just counting people. It's not just saying in those programs where you see how many persons can fit into this metro, no, it's like, okay, you're going to feed these people, but how comfortable are going them to be? And as you were presenting the whole thing about the new apps, the people that have the money, they use the apps. I mean, when we do these studies of persons with disability, of course, all of them, when they can, they use Uber. But if they don't if they don't can use Uber, and if they don't have a private vehicle, then that's what they have to do. So they have to walk a lot, and then just it's really difficult to move around once you have something. So I think it's just bring this thing to the table, keep on studying, keep on making some statistics, and keep on showing that these are groups that need transport. And then just, I mean, you just have to bring them to the table. And then this is when you see that things are changing, that there are some cities that are, okay, they are just putting these groups within the transport.
So purposeful representation, more dialogue, more evidence-based dialogue, and also really bringing them into the fore with the evidence. Right, there was one last question about the economic consequences of over and shared mobility and public transport. I think that from what we have found, the competition is limited. They're not really siphoning, except in some parts. There is actually a high potential for complementarity. But as Diana was saying, when people start getting tired of the low quality of public transport, that's when they start finding another alternative. And that we have seen in Bogota. I mean, people are tired of the packed buses of Transmilenio, which might have been great in the early 2000s, but now they cannot hold one more person. And that, of course, is bringing people to whatever alternative there is. So we need to find ways of, on the one hand, integrating it, because they're probably not losing revenue from that end, but they will eventually. And that's probably the case as in many other countries. Right. Sorry, Jeroen.
Something really quick on that?
Lynn, I can't, sorry.
Okay.
Followed a ton of questions in the chat. And what I would encourage you to do is literally answer directly to those people. We record the chat as well, so we can sort of put that in reports. We will be at the end of the seminar series putting all the presentations and recordings up on YouTube, as we always do, but we won't be putting them up until the end of the series because we want people to attend in person and not to attend the sessions and not just listen to them afterwards. So I'd really like to thank our few speakers. I just say it's an absolute pleasure to see that the IDB, who I think are really leading on this, have taken the issue of transport, low-income communities and social exclusion so far. Emma is just sharing a slide to say, don't forget the next session of this series is in 2 weeks' time, with a slightly different day and time because of accommodating for the fact that we're sharing the session with the Equimob team, who are in Dhaka at the moment, and they have a seminar series, and we're sharing that with them. So it's going to be focusing on Bangladesh and India and the Equimob project, thinking about intersectionalities between social exclusion, social inequality and transport in that context. And you need to go to our website to join, and you will be given a Zoom link to join. It would be great to see all of you guys here, and for you to please encourage others to join. There's all sorts of issues going on here around cable cars and specific modes of transport. I would also encourage you, if you want to ask Lynn and Diana and Daniel more questions about this specific report, to join their own seminar series, which will be a series of seminars, so can deal with all of these issues in much greater extent. So thank you all very, very much for attending. Thank you for your questions. It's been a great session. Thanks for kicking us off, guys, Lynn, Daniel and Diana. And we'll see you again. Keep up the fantastic work. 10 years, Lynn, I've been doing it for 20. Don't give up.
Thank you very much. Thank you.
Thank you.
Thank you.
Thank you for the opportunity.
Bye.
I think you can stop recording. And just to check with you guys that